There's no such thing as one standard of care, and nobody really tells you that. Your MP Pal here. Welcome to another conversation from the track. All right, so today's segment I want to call Standard of Care. And the reason I bring this up is because I've heard this over and over. And if y'all have been following along, you know I've worked a lot of places, okay? Especially the last 5 years I have been around, okay? So I've heard different things. Now, we know that there's guidelines, which is like the kind of overall, how you're supposed to practice, right? And then depending on where you work, the area, the field, the company, the organization, whatever, every place does things different, right? So either during, let's say, a 30, 90-day or annual evaluation, or just like a monthly sit down with your supervisor, right? Usually when somebody is pointing out the way that you do things, okay? So that's when you'll typically hear this phrase, right? And it's more, well, the standard of care here, right? And the problem is that there's not just one standard, because every place does things their own way. And so if you're a new grad or you've only been at one place, then it may be something where that's all you know, right? So especially if your boss has, let's say, been in a position, or they've only worked for that one company and then they get promoted and now they're over you, right? So when they are having a conversation, that's something that you might hear from that kind of situation. But coming from somebody who has been around, from every area except an actual specialty, but I've done primary care, ER, urgent care, hormone weight loss, direct care, basically house calls. I've done it all, and every place does things differently. So when they come at you and they say these things, oh, the standard of care, it can be frustrating, and it can affect your confidence, because they're basically telling you you don't know what you're doing. But the truth is, things vary from place to place. All right, for instance, so at one point, I've always had a main job and then a couple side jobs, just always kind of just in my back pocket, just because I like options. And if you ever work for a staffing agency, those shifts are, there may be times where they have a bunch of shifts, and then there's times where they have nothing. Like the one I currently work for right now, I haven't done any shifts for probably 5 or 6 months because they don't have any available. So I kind of like that option because I have another side job that I can kind of depend on. But there was at one point where I was doing workers' comp in 3 different places for all 3 companies. And when I tell you it was different at each one, my main job, I work at a construction site. So it's a big project that they're working on. It's probably a decade-long thing. But anyway, they like to do things different. It's more they're injured workers, but they're not necessarily workers' comp cases. So how you would normally proceed and just ordering certain things, you don't do that, right? And then I work for an urgent care, who we see workers' comp cases, but that particular company, it does not let NPs and PAs discharge. It has to be an MD, right? And then the other place I worked for was a full-time, all they did was workers' comp there. And so they like to order physical therapy and stuff like that, from the jump, because that's how they get paid, right? And so they're not wrong. It's not wrong. It's just things operate differently. So it's frustrating when you're having to sit down, or when your boss sends you an email or want to have a discussion, and they're well, the standard of care is this. What they're really saying is, that's not how we do it here, okay? And so I wanted to talk about this because if you're hearing this early on in your career, and I've heard it throughout my career, so and again, I know it may seem like I'm always having these conversations with supervisors. It's really not like that. I don't get in trouble. I've just worked a lot of places, and so people like to say whatever. I've had a bunch of evaluations where I'm just okay, or I've had a lot of monthly reviews where I'm just all right, and I've heard it over and over, and it's very frustrating because, yeah, And so what happened the last time I heard it, I'm not gonna lie, it just set me off. It was just a bad day, and I was not in the mood for that, and I was just frustrated. So I was having one of my monthly reviews or whatever, and that comment came up, and it was about actually a workers' comp case. And she said what she said, and I was just like, no, that's not true. I said, that's just not how y'all do this here. Well, what do you mean? No, this is the rule and blah, blah, blah. This is the standard. I said, no, this is not the standard. This is y'all standard. I'm like, because I can work other places and I can do a whole lot more. I said, it's very restrictive here at this company. So I'm like, that whole the standard, that's not even a true statement. And so she was kind of quiet after that. But I have to learn to kind of bite my tongue sometimes, not gonna lie, just because I don't know why I always get paired, like my supervisor, the people that are above me, they're either inexperienced or just they shouldn't be in that position, right? Or they work for the company a really long time and that's all they know. Like however that organization operates, that's all they are accustomed to. So for somebody like myself, like even in the hospital, right? I've worked at a small rural hospital that only had like 10 beds. And then I've also worked at a level 1 trauma center. So that's a big difference. So no, it's not going to be the same practice, the way that things operate. So it can be frustrating, and they will shake your confidence, and they'll try to make it seem like you don't know what you're doing. Oh, why did you do this? Oh, why didn't you just do such and such? Because at a small little hospital where the nearest real hospital is like 90 minutes away, you don't have the luxury of just picking up the phone and calling a specialist or just calling such and such real quick. You're literally out there by yourself. I mean, I've been in situations where it's just me and another doctor. And let's say you got to send somebody out and there's only one ambulance in the whole town and they're already at another hospital. So you learn to practice different. And so if anything, in those settings, you have to rely more on instinct, your assessment skills, and managing these really sick patients versus just, where you at a place where you can just call anybody or have a whole transport team and you can do this and you can, it's not the same. So sometimes they will assess and evaluate you based on whatever their standard is. So it's hard, especially if you're doing it simultaneously. Because I know I had a hard time just with certain places. I'm like, oh, I forgot where I was today. Oh yeah, y'all can't do this over here. Now I'm not vocal, but it just on the inside, just some of the things that I'm thinking about. And I just wanted to have this conversation with you because that's what we do here at UMP Pal. We have real discussions. We talk about things that maybe nobody else will talk about, okay? So just remember, don't let them shake your confidence. Don't let them make you feel like you're less than just because you may do things a little bit differently. But a lot of times you do just have to adapt and remember where you are, especially if you're doing it like simultaneously how I was. It's just because I started off my career, I was out of urgent care, but my boss, he wasn't like a helicopter, but he was observant because it was a private place and he owned it. So I understood, like, that's your business. Like, I understand that part. But I kind of could do what I wanted for the most part unless something, happened. So it's hard when you, like, have freedom in a place and then you go to a place where there's all these rules and things like that. You have, like, more eyes on you. You have all these people reviewing your charts and, oh, well, you don't. And it's kind of, especially when you're new to a place, because they're judging you based on, like how you do things. But it's like, okay, well, my last place, we didn't have to do all of this. So, like, and again, if you have inexperienced boss and they're, kind of judging and grading you based on your performance early on, it's like without them even really giving you a chance because they don't know any better because this is the only place that they work, it can kind of put you in a bad situation. And I just know that from personal experience, and it's not a good place to be, okay? So just remember, when they say that's not the standard, they're basically saying that's not how we do it here, okay? So guidelines matter. safety matters, okay? That's the thing. It's just, you use the guidelines, you look at the standards, and you make your decision based on all the data that you collected. And that's really all you can do. Like, a lot of times it's not about making the right decision, it's about making the best decision. Was this the safest thing that you can do for this patient? And sometimes, yeah, you might get backlash for doing certain things, but sometimes, whatever, okay? All right, so, like I said, we talk about these things every week at URNP Pal. So if you found this information valuable, I do have additional videos that I have available. I also put out content every week. And if you like this video, hit like and subscribe. As always, URNP Pal here. Practice boldly, and I will see you on the next one.